So you want to learn more about dry mouth? Let's be honest. Dry mouth can be terrible. It can be causing stinky breath throughout the day and just be uncomfortable. So let's talk about why saliva flow is important and bad breath and dry mouth happens. Glad you came to my channel today so we can talk about how to prevent and treat dry mouth and prevent cavities and gingivitis. My name is Becky Moore. I'm a dental hygienist for over 30 years, passionate about helping educate you on how to improve your oral health. And today's topic is about dry mouth. Now, who has heard the word xerostomia? Xerostomia is dry mouth. That's a proper term for it. It comes from not enough saliva flow in your mouth. It can lead to issues such as difficult swallowing for some people and even bad breath like we mentioned before. It also is connected to autoimmune disorders in the body, medication usage, radiation and chemotherapy for cancer therapy patients, as well as uncontrolled diabetes. So it's really important that we understand the implications, complications, and consequences of a dry mouth. It a lot of times goes under the radar. We don't realize that we're having. It starts out sort of gradual, and then sometimes you'll realize that your mouth is just very pasty. It's common for women during the hormonal changes of pregnancy and menopause. Medications like antihistamines, started noticing that it dries my mouth out more when I'm taking my antihistamine and sometimes my omeprazole as well. Really under the radar for our children. Our children breathe through their mouth. They don't have enough saliva flow sometimes, and that could be an increased risk of cavities for them. So having this knowledge will definitely help prevent disease in the children as well. So the main thing is to identify dry mouth so we can prevent cavities and gingivitis and gum disease. All right, so I like to use holistic ways and natural ways to treat things, conditions. So I'm going to recommend some of those for you today. So let's explore some effective, natural, and easy home remedies and natural remedies for dry mouth. 1, hydration, water. Drinking our water is very, very difficult. It says that the current recommendations for adults is 80 to 100 ounces of water a day. For our children, it would be closer to 32 to 64 ounces. So getting this water intake is very important for hydration of not only the mouth but the whole body. And a helpful hint is if your urine is more yellow, then you are more dehydrated. So the clearer your urine is, the more hydrated you are, and that is good. All right, second thing is chewing a sugar-free gum. This is one that is sugar-free, sweetened with xylitol. We're going to talk about xylitol quite a bit. But chewing gum can not only stimulate your saliva production, but it can also remove to stir around the bacteria and food debris after you eat if you don't have a chance to floss and brush. So picking a good sugar-free gum is very valuable to increase saliva flow. My favorite brand is the Spry brand. It is more xylitol that I like to use. All right, third thing, aloe vera gel. You can buy aloe vera gel just to use if you want to. Some products have it in the toothpaste. One of my faves, again, is the Spry brand. It has xylitol and aloe in it. So be careful to make sure you're getting the products that work for you. One thing that does go under the radar is that we use the common commercial toothpaste have sodium lauryl sulfate in it. They call it SLS. Now what this does is it dries the tissues out. So your natural tissues on your skin and your mouth are meant to be lubricated and moist. But when you use a product that's trying to clean, sometimes they use the sodium lauryl sulfate, and that can take the natural oils from your mouth and from your skin, and that can cause dryness. And so that's another product that we're using that may be working against us with the processes that are going on already. So be mindful of that as well. All right, next thing is oil pulling. You guys have probably all heard about the coconut oil, sesame seed oil. These are natural lubricants. Coconut oil is antibacterial and antifungal, which is also sometimes a problem in the mouth for the fungus. So oil pulling for just a few minutes with the coconut or sesame seed oil can help to lubricate your tissues as well. So very helpful there. All right, number 5, humidifier use. If you have tendency to breathe through your mouth at night, or you're dry when you wake up in the morning, humidifier may be enough to moisten your air. Depending on the type of the season of the year, you may have dry heat coming out, which can also make it worse, especially at night. So humidifiers can be really helpful to moisten the air and help to moisturize your tissues. The sixth thing that I wanted to mention was the use of essential oils. I like to use essential oils. I think they're very natural, and I think that they can be very helpful if we know how to use them. One that is up and coming that we're familiar with is grapeseed oil, commonly used for mouth symptoms. So you can put it in a little bit of water and swish it around your mouth, spit it out, and that should help to moisten and lubricate your oral tissues as well. All right, so here's a few more tips to think about, just to be mindful of when you are thinking about a dry mouth and what could be bothering you. So again, to avoid sodium lauryl sulfate, if you have a dry mouth, that's going to probably make it worse, so you want to avoid that. It can be irritating to the oral tissues and strip the oils from your tissue, so you do not want to use that. Avoid alcohol, caffeine, and tobacco. This one's a tough one. They can contribute to dryness as well. So, of course, smoking and tobacco tends to dry the tissues out, and that can be concerning for the oral tissues. Anytime you reduce your saliva flow, you're more likely that you're going to have more cavities and more gingivitis and gum disease, and that can be detrimental to your teeth and gums. So please remember that. There's a hard one. Breathe through your nose instead of your mouth. A lot of us are breathing through our mouth now, and we don't even realize it. You don't get enough oxygen to oxygenate your blood from your mouth supply, so breathing through your nose is always important. But getting back to the subject, breathing through your nose helps to keep your mouth tissues, when your lips are shut, moisturized. Your saliva can do what it needs to do. So saliva flow is important to keeping your mouth healthy. Keeping your mouth shut will increase the moisture in your mouth. Let your nose do the work for you. Okay. All right, consider using mouth moisturizers, which can be lubricating, like we talked about with the aloe vera gel. That's a really good product to use that you can help moisturize your tissues as well as coconut oil. We talked about them being very well for antibacterial and antifungal. That's important. Regular dental checkups. A lot of us have dental insurance that we don't use every 6 months when you have the availability to use it. So please keep constant. Find you a good dentist, a good hygienist that you like, and see them regularly. That can prevent a lot of disease. That can see things ahead of time that we can recommend that can save you a lot of heartache and hardship as well. All right, next thing is choose a mouth rinse that suits your needs. So the way marketing is now, it's so very hard to find a product that you're looking for. So I tell patients, whenever you start thinking, are you looking for anti-cavity? Or are you looking for antibacterial? Well, with dry mouth, you want to use something that does not have alcohol in it. We all know alcohol dries your mouth out. So a lot of time, the older ones that had alcohol in them were very drying to the tissues. So avoid alcohol when you're choosing your mouth rinse, and make sure you pick out the mouth rinse that you're looking for. So you either want an anti-cavity or anti-gingivitis. So just look on the back of the label and see what it says, and then make the best decision that you can. All right, this is one that patients have done for years and years and did not realize that they were doing it. They had a dry mouth, so they popped a sugary mint or lozenge in their mouth, and they sucked on that all day, every day. If you suck on a sugary mint all day, every day, the acids are going to form and you're going to have cavities. So this is very important that you understand. Choose a sugar-free mint. Choose a sugar, I've got some samples here, sugar-free mints. I love the Spry Berry flavor. Love this one. It's got xylitol in it. Also use my spray here that can moisturize your mouth, as well as the cinnamon mints. They work well too. So those are xylitol sweetened. So if you use something like this can lubricate your mouth and help you as well. All right, so we've covered several remedies that can help you improve your oral health if you have a dry mouth. Identifying the dry mouth is very important. The earlier is better. Reduced saliva flow over a period of time can really cause you to have a lot more disease processes, so a lot more cavities, a lot more gum disease and gingivitis. So choose products that will help you, that you will use. Try to avoid the sugary ones, the true sugars, because they will cause more problems. To me, this is a lot of information for you to take in, and I didn't mean to overload you with too much information. However, a win for me when I'm talking to my patients is if you can incorporate one thing and do one thing different and help you improve your oral health, then that's a win. If you can keep these consistent grooves in your pattern day in and day out and avoid the ones that maybe you were making before or the ones that aren't as good for you, then that's a win. So don't get discouraged. and know that you can make a difference in your health. I appreciate you watching today's video. If this was valuable and helped you in any way, please like and subscribe. I'm just getting started, and I appreciate you joining me today. Have a great day. I appreciate it very much, and I'll see you next time.